Welcome to the Plastic Surgery Podcast, a podcast where we talk about all things related to plastic surgery. I am Philemon Vianis. That is Dr. Vianis to my left. This week, we are going to be discussing mommy makeovers. So, just right off the bat, Dr. Vianis, what is a mommy makeover?
Well, mommy makeover is a series of procedures that can be performed to help a woman who has had pregnancies to restore their body shape to a more youthful appearance.
So mommy makeovers are just mostly for pregnant women or after pregnancy?
After pregnancy.
After pregnancy. Why would a woman want a makeover after pregnancy? Like, what are some of the physical changes that occur?
Well, so during pregnancy, most women will gain some weight, and that results in some stretching of the skin. They can get stretch marks, of course, through the pregnancy around their abdomen. There could be some deposits of fat area that they would like removed. Sometimes also the breasts around the time of pregnancy will get larger, and especially if they breastfeed, the breast may wind up sagging, so they would like to have a lift of the breast and improve the shape.
So this whole category is just basically for improving all the changes that occur during pregnancy, and each woman could have a different physical change.
Exactly.
Right?
Some may have minimal changes, others have more. Also, depending on the number of pregnancies sometimes, or if they have twins, that could really stretch out the tissue significantly.
Are these surgeries common? Are the the plastic surgeries after pregnancy common for women?
Well, the number varies, as far as the desire for a woman. So I don't have an exact number of how many.
But I mean, they're not uncommon, right? Like women.
They're not uncommon, no.
Yeah, right. Muscle does loosen, right? Typically during pregnancy.
Well, in the abdominal wall, and there's a covering around that muscle that we call fascia, and that actually gets stretched out, especially along the midline of the abdomen, and that's a condition that we call diastasis recti.
How would a plastic surgeon go by facing that?
Well, so the rectus abdominis muscles are those muscles that we look at when we talk about a six-pack, and they join in the middle. There's a midline area. During pregnancy, that could stretch out, and so a woman may have a protuberant abdomen, and that could be evaluated preoperatively to determine, first of all, is it just a stretching of the fascia or that muscle lining, or could it be also a hernia? And if it is because of the tissue stretching out, we can repair that muscle fascia and bring it back to the midline again. Usually what happens is the fascia that gets stretched out in the midline will cause that weakening of the abdominal wall musculature, and so they'll have that bulge. And so by tightening up that fascia that we talked about down to the midline, you can improve the contour of the abdominal wall. But when we repair that, if there is a hernia, we also fix the hernia. So a hernia defect is actually a through and through hole in that fascial layer.
So it can be either because of pregnancy or because of a
pre-existing hernia,
pre-existing hernia.
Usually from a pre-existing hernia. The hernia defect is basically a hole that's through that fascia, and it actually penetrates into the area of the abdomen where you have your organs and the fat tissue, and some of that tissue may wind up pushing through that hole like an open window, and that has to be repaired. So the abdominal contents have to be removed from that hernia defect, and it has to be repaired, and then we can also tighten up those that fascial layer to improve the contour as well.
What procedure is that?
So the hernia would be what we call a hernia repair, and the repair of the diastasis recti is essentially putting stitches that bring back that muscle covering back to the midline again. So we call that a repair of the diastasis recti.
If there is excess skin, do you perform tummy tucks?
Yes, an incision is made along the lower abdominal wall. Through that incision, we elevate the skin off of the abdominal wall muscle and that fascial area we talked about, as well as an incision around the belly button area. So all that is elevated off the abdominal wall, and then that gives us access to that muscle and fascia that's under there in order to tighten it up, or if there's a hernia, we can fix that as well. But some women may not have extra skin, and they just have that stretching of the muscle. So through a smaller incision, we can access that whole abdominal wall fascia and not make as large of an incision. We may or may not have to remove any skin in that scenario, and then all we're doing in that case is we're just bringing that fascia back together again and tightening it up.
I know a lot of women experience stretch marks during pregnancy, and nobody likes stretch marks. So how would one go by removing those?
So the stretch marks are from the dermal layer, which is the skin, part of the skin tissue that's deeper, that gets essentially torn and broken. And that's why you see those stretch marks. And some people have used different types of energy modalities to improve it. But the way that it is usually removed is through an abdominoplasty procedure.
What are the best ways that a woman can remove excess fat tissue?
The number one way is a weight loss program, but sometimes there could be areas that are resistant to weight loss, and there may be some fat deposits that may need to be removed, and so liposuction is typically used. And then you also have to differentiate whether or not there is extra fat or is it displaced fat, because again, that fat pocket that's under there may look like there's extra fat, but it might be that the skin's been stretched out and it looks like there's tissue that has fallen, and so that may require removal of the skin to reposition some of the fat and bring it up to another level.
You mentioned earlier that breast sagging is a cause of pregnancy. So how would a woman go and actually fix that after pregnancy if they wanted to?
If they do have sagging breasts, we also look at the size of the breast to determine whether they need a breast augmentation as well. Sometimes just putting a breast implant in will actually elevate the breast, but other patients may require both a breast lift and a breast augmentation with an implant. And that is a determination, again, you make during the preoperative evaluation. If there is enough tissue there that you could just do a breast lift, then that is another option that you have. So again, these are procedures that can be performed individually, like a breast lift by itself, or it could be breast augmentation by itself, or it could be both a combination of both breast lift and breast augmentation with an implant.
Just to clarify briefly, a breast lift does not involve a breast implant, but a breast augmentation does. Is that correct?
Yes, exactly.
Okay. So like a breast lift is kind of like a tummy tuck, like it.
So you're bringing some of the skin
up.
off. Yeah, you're bringing the skin up and you're lifting the whole breast.
When are these procedures usually performed after pregnancy? All these are performed after the pregnancy occurs,
yes,
correct?
So there's a timing issue also to determine whether the patient has actually completed her pregnancies, whether she wants to have children in the future. If the patient has decided that she is no longer going to have children in the future, then that would probably be the best time. And waiting at least 6 months after that last pregnancy would be best, because let's say, for example, if they decide to have more children, then all these changes and these procedures that you've done will wind up stretching out the tissue again, and there could be some changes. That doesn't mean that they can't undergo the operation, but it's probably better, especially with the tummy tuck procedure, to wait until after they finish having children.
For all these changes, each patient is different. So some patients might not experience any of these, and some patients might experience all of them.
Yes.
Correct? Just going back to the diastasis recti, there's no guarantee that will occur, correct? So just because a woman is pregnant does not mean she will actually have the stretching of the abdominal
Again,
wall?
everyone's going to be different. Some have more stretching than others, especially if they
there's going to be
babies,
stretching, right?
Right.
There will be stretching, but
sometimes they may have
rebound.
some rebound of the tissue. And
Like all the way back to normal without any?
well, again, the quantification of that is going to be hard to determine on some people. Again, some may have an issue with it, others may not. There's a genetic component too of how people heal and how strong that tissue really is. Right. Some people stretch out more than others.
That is all for this week's episode of the Plastic Surgery Podcast. Thank you so much for watching, and have a wonderful week.